Good morning. Thank you all for coming today. For those of you who are visiting our Brampton campus for this very special announcement, my name is Mohammed Lashmi. I'm the President and Vice Chancellor of Toronto Metropolitan University. Before we begin, I would like to acknowledge the land we are gathered on. Brampton and its surrounding area, the Peel region, are part of the treaty lands of the Mississaugas of the Credit. We acknowledge that these lands are also shared space for Anishinaabe, Huron-Wendat, Haudenosaunee, Ojibwe, Chippewa, and Métis people. We honor the indigenous peoples who cared for this land for thousands of years before us and commit to valuing the Churo Wampum. This living treaty represents settlers and indigenous peoples moving forward together in parallel, respecting each other's way of being, knowing, and doing. We honor this with one spoon territory, and in its spirit we strive to treat the land and people of our community with mutual respect, taking only what we need and sharing what is available to ensure sustainability for those that follows us. It's an honor to host today's exciting announcement here at Toronto Metropolitan University School of Medicine, where we are helping to shape a defining chapter in healthcare education in Ontario, one that strengthens primary care and highlights the value of education as a force for lasting change. Our first cohort of undergraduate medical students are now well into their first year of education at TMU. Building on that momentum, we are very close to opening our first integrated health center where our postgraduate residents will begin serving the community here in Brampton. Earlier today, many of us had the opportunity to tour the center, which will officially open next week, February the 17th. This facility represents a major milestone for our School of Medicine and a significant step forward in expanding access to community-focused healthcare. On behalf of our university, I want to thank Premier Ford and his government for their vision and leadership. Thank you, Minister Jones, Minister Quinn, Dr. Philpott, along with our Brampton-era MPPs for joining us here today, including Minister Sakaria, who is with us. We are deeply grateful for your support of our School of Medicine since the very, very beginning. Your commitment to advancing our shared vision enables us to continue delivering state-of-the-art education and healthcare to the people of Brampton and across the province. Thank you again for being here today and for your support of TMU and the communities we serve. I would like now to acknowledge our Provost, Roberta Iniechatu Provenzano, TMU, as I said, Provost and Vice President Academic, but also the Chair of the Integrated Health Center Board of Directors. And we have also with us a board member, Dr. Adam Kassam, and thank you so much for your leadership and dedication, both. Thank you for everybody who has contributed to bringing this new model of community-based care to Brampton. Now, it's my great pleasure to welcome to the podium the Honourable Sylvia Jones, Deputy Premier and Ontario's Minister of Health, big champion of this medical school. Minister Jones, over to you.
Thank you, Mohammed, and good morning, everyone. It is indeed great to be back at TMU in Brampton alongside Minister Quinn, Dr. Philpott, as well as your champion, MPP Prabmeet Singh Zakaria. They're all champions at Queen's Park for the health of Brampton families. I had the opportunity to join many of you in September for the opening of TMU's new medical school. And in November, I had the pleasure to speak to your first medical school students about primary care and other exciting opportunities taking place within our healthcare system. Thank you to Dr. Leshami and the team at TMU for hosting us again today, and for everything you do to train and support our future healthcare professionals and build a stronger, patient-focused healthcare system. Under the leadership of Premier Ford, our government continues to make record investments to protect and strengthen healthcare across Ontario, taking bold action to make it easier for patients and their families to connect to care closer to home. We are building capacity in our hospitals and healthcare facilities, including right here in Brampton, with the building of William Osler Health System's new state-of-the-art Peel Memorial Hospital. In 2025-26, our government increased operating funding to William Osler by over $18 million so that they can better meet the needs of our growing communities. We are also investing in local primary care teams so they can attach approximately 21,000 new patients to primary care, again, right here in Brampton. And our investments in primary care teaching clinics are supporting 2 new clinics here at TMU, one of which we had the pleasure of touring earlier this morning, which is going to connect an additional 14,000 Brampton residents to primary care once it opens next week. Our government is investing in the largest medical school education expansion in more than a decade, and growing and supporting our province's highly skilled healthcare workforce, with nearly 20,000 additional physicians being added since 2018, including an over 14% increase in family physicians. And today, I am pleased to announce that our government is investing an additional $30 million to expand our primary care workforce, again, adding nearly 1,800 healthcare workers to primary care teams as part of our $2.1 billion primary care action plan that will connect everyone in Ontario to a primary care clinician by 2029. This new funding will support the recruitment and retention of nurses in primary care, with over $4.5 million for a new innovative program that will help over 1,400 registered nurses gain skills and experience in primary care, including chronic disease management, cancer screening, maternal and child care, and immunizations. Launching this year, the program will be delivered in partnership with 4 post-secondary institutions. As one of the first programs of its kind that will free up more time for family clinicians and nurse practitioners to focus on patients with more complex needs. Our government is also investing $8.5 million to add up to 170 new primary care nurse practitioners education seats starting this year across 10 universities, including, of course, at TMU, who will receive funding for up to 17 additional nurse practitioner seats to be implemented by 2028-29, creating more nurse practitioners working in primary care. In addition, starting in 2026-27, our government is investing a further $16 million to add up to 150 new physician assistant education seats at Ontario universities, again helping to reduce wait times and improve patient access to primary care across Ontario. For Ontario families, these investments mean shorter wait times, better health outcomes, and convenience, knowing that they can get access to care when and where they need it. It's one more way we are building on our progress to transform frontline healthcare in our communities across Ontario, helping to train the next generation of healthcare clinicians here in Ontario and connecting more families to the care they need closer to home. Again, thank you to TMU, all our healthcare, education, and community partners, and of course, our incredible healthcare workforce here in Brampton and across Ontario, for everything you do to support and provide world-class care to patients and their families. It's now my pleasure to invite Minister Quinn to share a few words on his commitment. Thank you, and stay well.
Thank you, Minister Jones, for that kind introduction. Good morning, everyone. It's an honor to be here in Brampton at TMU's new medical school. And thank you to President Lashemi for hosting us today. And congratulations, Mohammed, on being awarded the Brampton Board of Trade's 2026 Business Person of the Year. It's great to be here alongside Minister Sakaria, Minister Jones, and Dr. Philpott. I may be biased, but Ontario is home to the best colleges and universities in the world. There is truly no better place to train for a successful career than here at our world-class institutions. Whether it's tech, engineering, teaching, or skilled trades, our students know they are getting an education that will equip them to lead in their workplace, positively contribute to their community, and strengthen our economy. And nowhere is that more evident than in our healthcare programs. Our government is proud to be driving the largest expansion of medical education in Ontario in over 10 years. We've added almost 900 medical seats at schools right across the province and established 2 new med schools at York University and right here at TMU. Even more, last summer, our government invested $56 million to train 2,200 more nurses for our communities. And earlier this month, we opened 2 new medical lab programs in Northern Ontario that are eligible for the Ontario Learn and Stay grant. Since its launch, the grant has provided over $171 million to support more than 12,700 nursing, paramedic, and medical lab students who commit to working in high-need areas of the province after graduation. So whether it's doctors, nurses, paramedics, or lab workers, our government is building a strong healthcare workforce across the entire sector. Because we know access to excellent care is not just doctors. It's every compassionate, highly skilled person who makes up our entire network of care. And there is nowhere better to train and reach your potential as a healthcare professional than our world-class colleges and universities. Which brings us to today. As Minister Jones just shared, these new physician assistant and nurse practitioner seats will bring more exceptional workers to Ontario's healthcare system. Along with the upskilling program for nurses who want to specialize in primary care, we're building a robust pipeline of workers that our families, loved ones, and our communities need to live happy and healthy lives. Today's investment builds on the significant work our government is leading to strengthen Ontario's healthcare workforce today and into the future. In closing, I want to thank not only our outstanding healthcare workers across the whole province, but our healthcare educators at our colleges, universities, and Indigenous institutes. Together, we're building a workforce that provides compassionate, connected care for our loved ones now and for years to come. Thank you, and I now invite Dr. Philpott up to say a few words.
Thank you, Minister Quinn. It is wonderful to be here today at TMU to celebrate this exciting announcement. TMU is not only one of the recipients of today's investment, but it is the university that has recently received funding to support 2 primary care teaching clinics, one of which we just toured, and it is fabulous. As well as to establish a primary care team, they are going to be connecting thousands more people to the care that they need very soon in the months ahead. Since launching the Primary Care Action Plan last January, 275,000 more people in this province have already been attached to primary care, thanks to the wonderful leadership of Minister Jones and the entire team in the government. This is real progress. We know there is much more to do. To keep building on this momentum, the government is making targeted, strategic investments in Ontario's healthcare workforce, and that's going to help us to ensure that every person in Ontario is connected to ongoing primary care. This education and these upskilling initiatives that are announced today are going to help us to ensure that nurses, nurse practitioners, and physician assistants are well equipped to provide comprehensive, team-based primary care. From the creation of this innovative new program that's going to support registered nurses who are transitioning into primary care settings, to increasing the number of nurse practitioners and physician assistants across the province, these investments are going to help build, recruit, and retain a highly skilled workforce that will be needed to support these new and expanded primary care teams across the province close to home. By adding more nurses and physician assistants to care teams, we're also supporting family doctors and nurse practitioners who are working in those primary care teams, freeing up their time so that more patients can get the care they need. Together, these initiatives strengthen our ability to deliver comprehensive, connected care for people across Ontario. They support our dedicated healthcare workforce, they support our communities, and most importantly, they help make sure everyone can get access to the care they need. Thank you to TMU and to all our partners for your leadership and your collaboration. With your continued support, we are building a stronger primary care system for everyone in Ontario. Thank you very much, and I would like to turn the microphone back to Dr. Lashmi.
Thank you for the Province of Ontario for your continued support and partnership with our university. Today's announcement is wonderful news for healthcare in Ontario. I want to thank everyone for joining us today. I would now like to invite Minister Jones back to the podium for the media Q&A. Have a wonderful rest of the day. Thank you.
We will now begin to take questions from the media. If there are any media present, you can come up to the microphone now to ask your questions. Okay, well, in that case, that concludes our announcement for today. Thanks, everyone, for attending.
Thank you.